Okay, so we're going to go over levalbuterol, section 16 PP. This will be used whenever we have an albuterol shortage or we don't have albuterol for whatever reason. We've ran into this a couple times within the last couple years, so just something important to know. It works pretty similar to albuterol. There's a couple differences, but we'll go over that here in just a second. So the class is a sympathomimetic bronchodilator. The actions: levalbuterol is relatively selective beta-2 adrenergic stimulant. Levalbuterol causes relaxation of the smooth muscles of the bronchial tree, thus decreasing airway resistance, facilitating mucus drainage, and increasing vital capacity. So I'm not going to read all the actions on every single drug that we go over here, but it's essentially the same thing as albuterol. That's the biggest thing to know. Indications are going to be the same as albuterol. You got your uncertain etiology for dyspnea, asthma, COPD, allergic reactions, smoke inhalation. The contraindications for levalbuterol, as always, known hypersensitivity to levalbuterol or albuterol. So you couldn't substitute albuterol for levalbuterol if they're having reactions to albuterol. Levalbuterol should not be used if the sole etiology of dyspnea is strongly suspected to be CHF, as levalbuterol-induced tachycardia may worsen the compromised cardiac output and congestive heart failure. So same thing as albuterol. We don't give albuterol or levalbuterol to CHF patients if that's what we're treating. Onset 5 to 15 minutes. Peak effect is 1.5 hours. Duration of effect is up to 5 to 8 hours. The half-life is 3 to 4 hours. Distribution: when inhaled, levalbuterol is distributed through muscle cells along the bronchial tree. Very little is systematically absorbed and distributed. The side effects: tremors, anxiety, dizziness, headache, cough, reflex bronchospasm, palpitations, tachycardia, and hypertension. The dosing for levalbuterol, essentially the same thing, again, as albuterol. We're going to give 2.5 milligrams nebulized for smoke inhalation. For pediatrics, it's going to be half that, 1.25. Allergic reactions, bee stings, 1.25. And then how it's supplied. This is probably the biggest difference. It's 1.25 milligrams per 3 milliliters or 1.25 milligrams per 0.5 milliliters in nebulizer vials. Always check concentration and dose per container at the time of medication administration. So as always, before you give the medication, just look at it and make sure that you're going to give the right amount. For pediatrics, it's going to be in the hand heavy. So use your hand heavy. For adults, just essentially treat it the same as albuterol. Just make sure you know the packaging is slightly different. And that's it for levalbuterol.